Hi, everyone. Today I have with me Dr. Christina De Avila, the Portuguese naturopath, a fellow colleague of mine and classmate of mine. Thanks for being here, Christina. Why don't we start off by you telling us a little bit about yourself and the work that you do?
Yeah, so as you mentioned, so the Portuguese Naturopath and class of 2014. Can't believe how much time has gone by already. Um, but yeah, so practicing for the last almost 6 years now, with an overall general practice, I would say, but my focus is definitely around diabetes prevention and management, and really empowering people to look at the nutritional and lifestyle practices that they can adopt to really support their health and well-being. And that has caused me to continue my education and achieve the additional designation of certified diabetes educator. And in the last year, one of the things that really came up for me was, a very common theme I find a lot of patients say is, how stress at work impacts them, or, my boss is such a micromanager. And that started me thinking about, what is beyond the individual that really starts to impact their health that is not necessarily a part of their control. So I went on to do a postgraduate certificate in workplace wellness and health promotion, and really looking at things like organizational culture and corporate policies, and even the built-in environment, and how, looking beyond the individual and how all of these different factors start to impact our health and well-being without really, maybe being at the forefront of our mind, which was, really interesting and created for very exciting opportunities. And I think that's the life of a naturopath, right? We're constantly learning and developing so that we can be better advocates for our patients and really support them to be their best selves.
Yeah, that sounds amazing, because also like our work environment, sometimes we don't relate it back to our health, right? Like, and how it impacts our health. Because
Mhm.
sometimes when we think about our health, it's like we think of work separately and then the rest of our life separately. But our work and where our mind is at plays such a big role in all aspects of our health. So I love that you've made this transition and made it a big part of it, because all our connections, whatever they might be, have a huge impact on our health. A lack of connection, too much connection, not healthy kinds of connection, like all of those sorts of things, right?
Yeah, absolutely.
Okay, so I know you talk so much about blood sugar regulation and dysregulation. So can you take us through what normal sugar metabolism or normal carbohydrate metabolism looks like, and
Mhm.
then also what dysregulation looks like? Can you share with us a little bit about both?
Absolutely. So, keeping it really simple, I think the main players when we start to think of blood sugar regulation is the notorious insulin. And then the sort of counterbalance hormones are things like cortisol, adrenaline, that will, kind of push the dial on the other end, as well as glucagon. So when we take in food, in particularly carbohydrates, we take those in, they're going to break down into sugar. And insulin is going to come out as a way to respond to the blood sugar rise, because the body likes to keep the internal environment quite stable, and within a very, confined gap. So with consuming a meal, obviously we're going to cause a disruption in terms of where that level is now lying. So insulin will come out, and what that's ultimately going to do is cause the cells to say, okay, let's take in this sugar, where that is going to be converted into energy, which is going to support everything we do in our day-to-day, whether it's focusing on a task on our computer, whether it's, walking from point A to point B. This is all going to be fueled by burning off of sugar that's been converted to energy. If we consume a little more than we should, which can happen, it will then be also converted into glycogen, which is going to be stored in our liver and muscles. In the event, the body likes to be safe and kind of have a storage system just in case something happens and it needs to pump out sugar to support us. And otherwise, anything else is going to be converted into fat. On the flip side is when our blood sugar starts to dip a little lower, think about when you've been back-to-back meetings and you haven't been able to grab a bite. The body is then going to shoot out, like I said, the glucagon, in a very severe case, probably some cortisol and adrenaline, which is going to mobilize those stores, like I said, is in the liver and muscle, to then bring blood sugar back into that, normal state. And this is a constant ebb and flow. The body's always monitoring and shuffling things to make sure you are okay. Now, when things start to go awry, is when people start to notice, for example, on one side, if their blood sugar is dipping too low and their body's not necessarily responding quite well, they'll start to maybe get some headaches. They're not able to focus. They're like, I'm sitting at this computer and I've read the same sentence 5 times and I'm just not going anywhere. This really starts to highlight the fact that for the average person, the brain uses sugar as its main source of fuel. So as soon as that starts to drop, our mental capacities are probably not where we want them to be. As I mentioned, with adrenaline and cortisol sort of coming into the picture to kind of help us bring back things to a normal state, people can start to feel more irritable, even maybe a little more anxious. They're like, my God, my heart's racing. I don't understand. And this is all just internal signals that your body is trying to mount to tell you, we've got an issue and we need you to help resolve it. On the other side too, though, if we've eaten a really large meal and we're starting to get insulin spikes, and maybe we're not as receptive to insulin, which is often termed insulin resistance, people can often feel very fatigued and lethargic. And, after a meal, they're just like, I just don't have it in me to do anything else. And that can be a sign of a dysregulation on the other side. So always kind of paying attention to where people are lying with respect to, blood sugar regulation can help us identify where the problem is lying.
Okay, that was a great explanation. And you touched a little bit on insulin resistance. And I have a personal history of PCOS, and there's, insulin resistance at the root of that. And we're seeing a lot more insulin resistance in the population as well. Can you explain to us a little bit more in depth what insulin resistance is?
Yeah, so insulin resistance is, simply put, like we're not responding to the hormone, which is insulin. Or we're not, so ultimately we're not responding. And it could be that it can actually be, so what happens is, think of like a key and lock type of analogy. If we have the wrong key, the door is just not going to open. And so if that door is not opening, then sugar is not coming into the cell, which means it's coming out of the bloodstream and then allowing our blood levels to, like I said, come into that more normal state. The other thing could be that we don't even have a lot of receptors for the insulin to bind to. So we have a key but no lock, let's say. So that's probably not happening either. And what ultimately pushes us into that state is just chronic elevated blood sugar levels, or chronically ingesting a lot of foods that cause that elevation. So the body's constantly responding, and eventually it gets kind of almost tired, or it starts to create more of adaptive response where it's saying like, we have too much sugar. We don't need any more. And the cells are packed. They're just like, we don't need anything, so leave it out in the bloodstream. And that's where the problem starts to lie. So it doesn't matter how much insulin the body's pumping out to try to bring things back into a regular state. The system is just so overloaded that it's just not listening, so to speak.
Okay. And how does the higher amounts of sugar and insulin in the bloodstream then impact our health, and what can that look like short-term and also long-term when we're talking about the development of chronic disease, like, cardiovascular disease, diabetes, and stuff like that?
Yeah. So, sort of what I first mentioned initially is when we take in sugar or when we take in carbs more specifically, and it's down into sugar, if we are not burning those calories, then the body likes to store things. Just like we deposit money in the bank for a rainy day, the body is going to do the exact same thing. And like I said, if those glycogen stores are now full and it doesn't need any more from that standpoint, it's going to then convert everything for fat and store it that way. So when we start to think of things like, diabetes or non-alcoholic steatohepatitis, which is just fatty liver, that is where a lot of that is kind of coming in, right? The body's just converting things into fat for storage, and it's starting to pack it around internal organs, really. So our liver, our pancreas, which can also attribute to some of that insulin resistance picture. In addition, because elevated blood sugars are sort of more consistent and chronic, that is ultimately going to cause a lot of oxidative stress to the body and inflammation. And I know those are words that sort of, float around quite a bit. And more often than not, everyone says inflammation is the root cause of all, most chronic diseases. And, that is true to a large extent. So, and that has to do with the fact that the body is not equipped to tolerate elevated blood sugar levels. And so it's just going to create a lot of damage from that standpoint. It also can cause a lot of, from a cardiovascular disease standpoint, when we've got crystallized fragments in terms of blood sugar starting to circulate, that can really cause some micro tears in some of our, especially smaller and more fragile blood vessels, which are the capillaries. And, for some people that can mean, the fingertips are always kind of cold, or even if we're starting to suspect some nerve damage, they get some numbness and tingling sensations, which is very common in, diabetic neuropathies. So those are the things that start to happen when blood sugars are constantly staying on that higher end, and it starts to attack a lot of different organs. And, just from sheer fact that it is circulating, anything that the circulatory system is coming into contact with is also going to be, an end, what do I want to say? Like an end result of that damage.
Yeah, there's so many different consequences, right? And so many different changes that it can cause. And if we look at insulin as a hormone, it's also pro-clotting, which will impact, the risk for developing cardiovascular disease. And if we're going, again, I always tie things back into the hormonal system. In PCOS, that's also why we see a higher rate of miscarriage, right? As the placenta is developing and someone with PCOS has higher insulin levels, then that's pro-clotting, which means the development of the arteries and the veins and the placenta and blood flow will be impacted. And we can see that in pregnancy outcomes and baby outcomes also, and fetal outcomes. So it's so interesting, all the changes. And even not talking about PCOS, the cortisol issue, right? Like that comes into play, and packing on of maybe some visceral fat, so the fat around the organs, and those organs can then, that fat is hormonally active. It can actually increase inflammation, which perpetuates the cycle, right? Yeah. So there's so many different things, and then it can impact your sex hormones and the way you feel. So it's such a interconnected web, but such an important one, because we eat on a daily basis, and there's so many, not just dietary factors, but other factors that are at play when we're talking about blood sugar dysregulation. So can you share with us some of the other lifestyle habits and dietary habits that come into play with this, and what some of your recommendations might be?
Yeah. So, I think one of the most common statements I make in my practice is that nutrition and physical activity are foundational. And as a naturopath, if I do not talk about these things, then I can't really call myself a naturopath. Yeah. So, that is always an area of conversation. I think, just having, an education around, good carbs versus quote unquote bad carbs, or looking at, starchy vegetables versus non-starchy vegetables, and what are the benefits of, swapping some of those in and out of the diet. Protein becomes a huge one. Mostly because I feel like a lot of people don't actually reach even like the minimum requirements. And when we are talking about a blood sugar dysregulation picture, if that is the case, starting your day with a high protein, high fat breakfast can really set the tone for the rest of the day, so that you are not falling victim to these hormones, which will ultimately, possibly derail you and put you in a position where, you're acting just through, the symptoms that are arising. So that is huge. One of the things I love to show patients is an actual graph of, blood sugar and protein, carbs, and fats over time, and just showing the different dips and impacts of the different macronutrients, so that they can understand what that means internally as they're trying to figure out what their plate is going to look like each and every meal. So that's important. And we know that cholesterol is the backbone of hormones, right? So I feel, we've been in a society where fats are bad and stay away, and, but we know otherwise now. So, getting those avocados in, getting those goods, nuts and seeds, olive oil, coconut oil, these are all really great things to have in the kitchen and consume on a regular basis. So, and then always, nutritionally, we have to meet people where they're at too. So making those modifications with, if someone's vegetarian or vegan, and, kind of still helping them there. And, that can be quite hard when we're starting to figure out, protein sources that are not so carb rich, especially for vegetarians and vegans. But that's always, a work in conversation. With respect to physical activity. So, the body is meant to move. And there's so many benefits of movement, with respect to mood, with respect to even brain health, and making sure we've, got good working memories. We know that exercise can actually increase the volume of the hippocampus, which is where short and long-term memories are stored. It actually makes us more reactive, so we're able to, respond to different environments. So, that is one thing. But the other thing too is we know that there is a direct impact when it comes to blood sugar regulation and even increasing insulin sensitivity. So on the opposite side of insulin resistance is, how do we become more sensitive to the insulin that is being secreted by the pancreas, such that we can be better at, maintaining that blood sugar within a certain range. So, whether it's cardio or strength training, each has sort of its, purpose. And so, we know that with strength training, we are going to develop tissue that is more metabolically active, and will automatically just burn more calories while you're sitting. So that's going to help from a blood sugar regulation. But also, when we think of strength training, we're building muscle tissue that ultimately doesn't even really need insulin to help it, pick up sugar from the bloodstream. So imagine that now we've completely removed insulin from the equation, and we've developed a way to just be more efficient. So, meeting again, and it's always about meeting people where they're at. So if they're not moving at all, let's start with a 5-minute walk. And gradually build. And, for some people it can be very intimidating to think about strength training. Especially if you've got a picture of like these big bodybuilders and you're like, oh God, I can't, go lift a 5-pound weight. It's okay. So let's take a step back and, think of other things and be creative. And eventually people will innately want to explore their strength and physical fitness. And then, I feel like there's always room for certain vitamins and minerals and, the beautiful herbs that I love to use in my practice that can, still help, the body where it needs some extra support. Especially, we have to think of where people are along their journey. And, if people have had, for example, chronically elevated A1Cs, which are a measure of your overall blood sugar regulation in 3 months, then we really want to, increase that antioxidant support. We want to increase a lot of the nutrients that are often needed, such as the Bs, and for women, B6 becomes a huge one. So just starting to think of those gaps that could need additional support.
Yeah, for sure. And I love that you talked a little bit about HbA1c. Can we dive a little bit into what some of the blood parameters that we can measure when it comes to blood sugar regulation, insulin sensitivity, insulin resistance, that sort of thing?
Yeah. So classically, I feel, most people, especially with their family doctor or their endocrinologist, fasting glucose and A1C are more often than not included. So like I said, A1C is a measure of your blood sugar over 3 months. So it gives a more complete picture versus fasting glucose, which is just a snapshot. It gives us what your blood sugar looks like in this given moment, which isn't really reflective of overall trends and patterns. That being said, there's a lot of other ones that can really help us determine what is going on as well. So one of the things that I like to do is with the fasting glucose, also having the fasting insulin, because then we can calculate something that's called a HOMA score, which tells us how much of an insulin resistant picture is there. And then with that, again, we can better navigate which clinical tools will be most beneficial to help people, overcome that and decrease it and ultimately increase that insulin sensitivity score. I would say those would be the biggest ones for me. If we start to look a little more on a hormone side as well, like we can start to see, for example, if someone's testosterone is being pushed a little higher, especially for women, especially with a PCOS type of picture, then we know that insulin is probably causing, instead of promoting more of the estrogens, it's, causing things to convert to more of the androgen type picture. So seeing that interplay as well, which can be mixed if we're only looking at insulin within blood sugar, we're missing the effect of insulin as a hormone on other, hormones, including the sex hormones.
Yeah, I like that you touched on that, because conventionally speaking, like you said, it's usually, A1C and glucose, and then that insulin piece is missed. We can really get an idea of where on that spectrum someone is. And then, like you said, to tailor their treatment plan, tailor like what needs to be done, and really get an idea of where they're at, and then address that appropriately. I deal with a lot of PCOS, so a lot of women will come in and they'll tell me, well, my fast, they said that I have no problems with my blood sugar, but then we'll run the insulin or do the HOMA IR calculation, and then lo and behold, there is insulin resistance present. And then we can now, regulate their hormones, change their skin, and do all of these other things that, that lend to better health. And, we talked a little bit about cortisol, the stress hormone cortisol. And I kind of use that term stress hormone loosely, because we always attach this negative connotation to it, right? But we need cortisol.
Right.
It's really, really important. So can you speak to that a little bit? How does cortisol come into play? How can blood sugar dysregulation impact our mood? And then how can, just our go lifestyle impact our blood sugar regulation?
So cortisol, like you said, it's, poor thing, it gets such a bad rep. But like you said, it is necessary. And, anyone with adrenal fatigue would probably tell you, yes, I'd like some of that, please. So it is I like to think of it as, our umph in our step in the morning. It really just kicks us up, it gets us going. But it's supposed to, gradually decline throughout the day so that we can go to bed and sleep, right? And get that good quality sleep. With this constant go, and, we're notoriously trying to do 50,000 things at one time, we're constantly pushing on the adrenal glands to respond and think like, oh, my adrenal glands would say, oh, Christina's got this to do, so let's give her some cortisol, right? And it's constantly trying to make sure that I can deal with you know, whatever I'm perceiving as a stress. So we always have to remember it's what we perceive as a stress that will cause the adrenal glands to respond. Now it's interesting because cortisol is sort of, I always think of like cortisol and insulin as, you know, kind of like enemies in the battlefield, just because cortisol will be one of those factors, if chronically elevated, that will ultimately push that insulin resistance factor up. And that is why stress management is so huge when we are talking about insulin resistance, whether it's, you know, someone who's in pre-diabetes, whether it's someone who's in full-blown diabetes, or even people who are dealing with things like PCOS, where there is an insulin resistance underlying issue. So, you know, we have to think about that. And the other thing I would say is just kind of coming back to what I said in the beginning is when we are in that more cortisol driven state, it's going to impact our mood because we're probably feeling more frazzled. You know, maybe our patience is a little lower and we're more irritable and, you know, maybe even a little quick to anger, versus, you know, actually, and in addition to cortisol, we have to think of, you know, the other sort of counter regulatory hormones to insulin, which is that adrenaline, like I said. So we feel shaky, we feel, you know, maybe our heart's racing a little more, we feel anxious, like this, you know, there's an upcoming doom that we're not quite sure, you know, whether we'll be able to take it on or not. And that's where a lot of that mood type of pictures start to come in. And we know that as well with like cortisol, it impacts the brain. So, you know, we have very clouded judgment or thought processes, and we're just not able to focus. So a lot of that's going to start to come into play. Yeah. So I think that's where I would go with cortisol for me. Those are usually the thought processes I think about. And for me, that's where I start conversations around why stress management is so important and how we even perceive the things that are in front of us. Because it's always that perception piece is huge.
Yeah, absolutely. And, you know, for everything else too, right? It's
Yeah.
a crucial part of our life, and including the blood sugar regulation and having, you know, a more even mood and having better focus and all those sorts of things. So to summarize, I know you before said that fat and protein for sure, like focusing more on those sorts of foods, antioxidants, you know, fruits and vegetables, great sources,
Yes.
supplement if necessary, talk to your naturopath.
Yes.
We talked about movement. And then what are some of your other tips and tools that you might recommend to patients? So stress management wise, for example, what do you recommend?
So with stress management, again, again, as naturopaths, we always talk about the individual, right? And, you know, there's not one protocol. We always have to look at the person who's sitting in front of us. And I think that really resonates with stress management because some people might gravitate to meditation and it's their end all be all, and it's their sort of magic silver bullet that they know will help them, you know, come out of that stressful situation. And for other people, meditation is absolutely more stressful and they don't like it at all. So when it comes to stress management, I like to explore, you know, what do individuals innately like love to do, right? Here's the thing with stress management. It shouldn't be something you have to do to help manage your stress. It should be something you do because you love to do it. So, you know, whether it's tapping into a creativity, energy, so for some people, it's maybe coloring or painting, maybe it's singing. You know, if you're a reader like me, it's having like 50,000 books on your nightstand so that you can grab it up, grab a book at the end of the day and just read a couple pages before you go to bed. You know, for some people, it's going for a walk and talking out, you know, whatever's on their mind with a friend. For some people, it could be journaling. Or even maybe starting their day with a journal as a way to, you know, set an intention or, cultivate a purpose for that day, whatever that might be. You know, for some people it's yoga, which, you know, I like to always think about it as meditation with movement. And for me, that's one of the things I really align with. So it's all about, trying new things for somebody who's, maybe not quite sure what they like. But otherwise just asking, like, what do you love to do? And do it, find the time, carve out that space and make sure that you have you time, because with everything that goes on, we often forget about ourselves. And, we are the most important person to ourselves. So we have to make sure to, support us so that we can be our better selves for the world, for our partners, for our employers, and make sure we show up every day fully charged, so to speak.
Absolutely. Self-care, there's so many benefits to it. It goes without saying, but it goes out the window so often, right?
So often.
And even though, and then when you do it, you're like, oh, right, that's why I like to do this, because you feel so different after you do it, right?
Mm-hmm.
So thanks, Christina. I loved everything that you talked about today. Are there any other tips or resources that you have for people, and where can people find you if they want to connect with you?
Yeah. So one of my favorite books, not only as a naturopath for a reference, but for people who are maybe more innately curious to understand their body, especially with respect to insulin and the role of blood sugar regulation, is Master Your Diabetes by Dr. Mona Morenstein. She's a wealth of knowledge, and I think everything she has in there can really support anyone, anywhere along their journey. And then I would say, find a good naturopath where you can have these types of conversations. And then my last tip, I guess, would say is take it one step at a time. It doesn't have to be an all or none approach. And, if you're curious, like, I really just want to talk about my nutrition, then start there. Because it can sometimes be overwhelming. And like we said, it's such a web when we start to tease out one thing, and before you know it, you're talking about 50 other different things. So, just kind of bridging those pieces together slowly and a meaningful way can be quite powerful. As to where you can find me, you can find me on my website at www.theportuguesenaturopath.ca, and on Instagram at The Portuguese Naturopath. You can also find me on my Health Buddha channel on YouTube, where I have fireside chats with naturopaths on a variety of topics. So you can always find me there. And yeah.
All right. Thanks so much, Christina. I will leave the links for how to find you in the description for this video. I'm so glad we had this chat. Blood sugar dysregulation is so prevalent. So I'm really happy that we are able to provide this resource to viewers.
Yeah. Thank you so much for having me.